Okay, so this is going to be my week 1 health assessment 2 video. So the first thing I would do is just knock on my patient's door. I would do my hand hygiene as I come in, provide privacy behind me. I would acknowledge my patient, introduce myself, let them know what I'm about to do and about how long it's going to take, and then thank them for letting me do the assessment. Next, I would ask them their name and their birthday, and I would compare it with their armband. I would assess their pain, and then I would ask them if they have any allergies. Next, just starting off, I'm just gonna kind of go with like the upper half of the body. So just inspecting the carotid and the jugulars. And then I'm going to, and I'm just kind of like looking for like any like pulsations, looking for any JVD, which is absent on me. So then I would go to palpate the carotid arteries. So I would do that sequentially. So I'm gonna go ahead and palpate. And I'm also palpating for a thrill, which I did not feel. And then I have a regular rate and rhythm, and they're about 2+ bilaterally on both sides. Next, I'm going to use my stethoscope. I'm gonna use the bell of my stethoscope. And I'm just gonna auscultate for a bruit in those carotid arteries. And I did not hear a bruit. Next, just kind of inspecting the arms. So just kind of noting, I don't know how I'm feeling because I'm just inspecting. So just noting like the color, it's appropriate to ethnicity, my skin integrity. I don't have anything open on my arms or my hands. Looking at my nails. So my nails are painted. Normally, like in a hospital setting, you could get like a nail polish remover and take your patient's nail polish off if you couldn't, if you needed their cap refill or anything like that. But my nails are intact. I don't have any clubbing or anything like that. I would probably then just move on to my brachial and my radial pulses. So starting with my brachial, I'm gonna just feel. And that one's like a 2+, that one's normal. And that one is a 2+ as well. And then normally you would want to do this like both at the same time just to compare like one's not weaker than the other. I can't do that, it's really hard for me to do that. But on an actual patient, you would want to do them both at the same time. So same with radial. So I'm gonna go ahead and check my radial. And that one is 2+, normal rate and rhythm, as well as the right one is 2+, normal rate and rhythm. And then I'm gonna go ahead and palpate for my cap refill. So like I said, I know I have nail polish on, but we're just gonna pretend that I don't. So I would just kind of push on my nail bed here, and it should turn pink in like less than 2 seconds. And I would just wanna do that bilaterally on both fingers. And cap refill is there. Next, so moving on to my lower extremities. I know you can't see my lower extremities, but just kind of starting with like inspection, I'm just gonna observe my skin color. So looking at my legs, my skin color is appropriate. The texture, I have a normal texture just kind of at first glance. I do have some dry skin sometimes, so I guess I could note that, but it's not like flaky or overly dry or anything like that. Observing my hair distribution, it's normal. Observing for edema, I don't have any. I have no lesions, I have no ulcers. Especially looking in like diabetic patients, you definitely want to look in like toes, feet, kind of the like medial malleolus area as well, just to kind of make sure that you don't have any ulcers there, which I do not. And then I don't have any viscosities on inspection either. Next, I'm just inspecting my calf size. So looking at both of my calves bilaterally, they're both the same size. If I noted that one calf was bigger than the other, then I could grab like a paper tape measure and I would make sure to measure and make note of the size. Next, I'm going to move on to my palpation. So I'm just like palpating my lower extremities with the dorsa of my hands. So palpating both legs. My temperature, it's warm, skin is dry, normal temperature. I don't have any, you know, they're not cool or anything like that, not overly warm. Texture, like I said, a little dry, but nothing too crazy. My hair is, like when I feel it, it's evenly distributed. I'm feeling for any edema, which I don't have, even in like my lower, like my feet. No edema on either leg. Just kind of feeling over like the shin area and then moving down to the foot. I don't have any. And then next I'm going to palpate my pulses. So I'm gonna like move my camera so you guys can kind of see like what I'm kind of doing. So you couldn't see me like palpating my legs. So I'm gonna move this over. Sorry. Okay, so let's see. Starting with my, so I'm gonna start up at my femoral. Let's see, sorry, I'm gonna stand up. So I would just kind of palpate up here, like my femoral, and then do my other side. And those ones. And then I would move on. So popliteal, and those are 2+, those are normal. Those are 2+, I can feel those. So popliteal I know is a little bit harder. So what I would probably do, like if I was in the hospital, I would have my patient lay down and I would lift their leg and I would hold it and then I would feel right here for their popliteal. I know that one is like one of the hardest ones. I was practicing earlier and I couldn't feel it. So if I couldn't feel it, then I could get a Doppler and use it, but. So to be honest, I don't feel that one on that leg. We'll do this one. I don't know if it's because I'm sitting down and not laying down, but so like I don't feel that one, but I would get a Doppler and I would do that. Next, I would move on to my posterior tibial. So right in here, if you can see that. And that one is 2+. That one's normal. I'm gonna go to the other side here. And that one's also 2+. And then moving to my dorsalis pedis. I don't know why you can't see my feet. Sorry. Okay, so moving to my dorsalis pedis. So again, I'm feeling bilaterally at the same time, just so I can compare the rate and rhythm and like, you know, I wanna make sure that one's not weaker than the other. And those are 2+ as well. I can feel those. Okay, I'm gonna move this back up. So those are all 2+. Like I said, I couldn't feel the popliteal, so, but I can feel my distal pulses. So honestly, I probably wouldn't be super concerned, but if I really wanted to, I could get a Doppler just to kind of make sure that they're there. But if you have distal pulses, then you know your extremities are getting blood flow. And then after that, so that wraps up my peripheral vascular assessment. So I would just reassess my patient's pain. I would offer them any comfort measures. I would ask them if they need anything before I leave the room. I would thank them for letting me do an assessment, and then I would do my hand hygiene on the way out.